Welcome back, everyone. Our Health Watch today focusing on women's health. A new study finds that women likely have a lower normal blood pressure range compared to men. So, Dr. Berger, important information we need to get out to our audience, particularly women, about this new study. What exactly should women know? Because I think the numbers before were different, and now we're saying that the numbers are new. Talk a little bit about this new study and what it tells us.
This is a really important study. It's having us relook at what the guidelines should be for women. We used to have a one-size-fits-all approach to hypertension and would really try and treat everybody to 120/80. And this study is saying that women, even with a blood pressure of 110/80, may be at increased risk for heart disease. It looked at a lot of women and looked at what their risk for developing heart disease later on in life was, and found that even with lower blood pressures, that they were at increased risk for heart disease.
So I guess the question is, how could this have been, I wouldn't say so wrong in the past, but why was it that we were going by different numbers? Is it just simply that we weren't studying women separately from men, or that we weren't paying closer attention to factors that impact women more than men?
Exactly. That's exactly what it was. We weren't studying women. And it's only been in the last decade that we've really been trying to understand what the differences are in terms of the heart health and the health in general of women versus men.
So now
we're sort of rethinking all of this.
Right, indeed. And so with this new study and women now having these new factors, what is the bottom line here? I know we've always said know your numbers. Now they're different. So beyond that, is there anything more that women should have to know?
Absolutely. So this is really a hypothesis generating study. This is looking at data over a long period of time looking back. So this is telling us we need to do more studies to better understand how women's hearts work and women's health works. And so we need to really drill down and try and understand, is this a new number? Does this need to be incorporated into the guidelines? And women do need to know their numbers. I tell my patients that they should get blood pressure cuffs.
Right.
They can pick them up at the pharmacy. They can buy them online, and they can check their blood pressures periodically. And then they should meet with their doctor,
right,
and find out what their blood pressure goal should be.
Indeed. Very important information. Dr. Rachel Berger, board-certified cardiologist with Virginia Health. We apologize for the mistake on top, but we'll be sure to have you back and make sure we get that title and your name correctly. Thank you for your patience and time this morning.
Thank you so much for having me.
We appreciate it. Important information for every woman out there. Thank you.